It's Breast Cancer Awareness Month, and today is National Mammogram Day. And I want to share with you why I know firsthand how important it is to get screened for breast cancer. For the past year, I have been battling breast cancer, and this is going to be the first time that I'm talking about it publicly. And I want you to hear me when I say, get your mammogram.
And that's exactly what we're setting out to do with our new ABC 15 Checkup AZ. We want to remind you all how important early detection is.
That's right. And for the next hour, we are going to talk a little bit about my journey, but most importantly, we're going to talk about prevention and maybe even some treatment options should you be diagnosed.
Yeah, it's really tough to talk about, so we sat down and had a very candid conversation about your journey over the past year. Take me back to about a year ago when you found out your diagnosis.
I don't think I've still quite embraced it. I got diagnosed in October of last year. I had my surgery in January. 3 or 4 weeks after that, I did 33 treatments of radiation. Again, I feel lucky. I didn't have to do
chemotherapy.
Oh my God, had I lost this, I don't know.
Right.
And my sisters out there who did, and these are the most resilient, amazing women I have ever met in my entire life. At my last treatment, when I got to ring the bell, I was so emotional. What would have happened had I not gotten that mammogram?
One of the things that you talked about early in your journey was learning the type of cancer that you have.
Yeah.
That matters. You know, there's several different types. What type were you diagnosed with?
So I have ductal carcinoma in situ, HER2 positive, which in our term, talking girl to girl here, means if you're going to get breast cancer, it's the kind to get.
Yeah. Okay.
So I was grateful for that. It's a slow moving cancer and it has a tendency to stay very isolated.
Right.
So having had gotten that mammogram when I did, I feel like, you know, somebody's watching out for me.
Yeah.
And had I prolonged it even 6 months, Heidi, I don't know, that could have made all the difference in the world. Because I've talked to so many women who have put it off, even for a short period of time, only to get that diagnosis that changes everything.
Everything. I think as women, we are always putting others first or thinking about our to-do list. And in that same vein, we try to protect the people we love.
Yeah.
How did you tell your mom?
Oh, that was hard.
Yeah.
Because as you know, and everybody knows, she just turned 100, so she's 99. I'm her baby. We're very close. And I knew my husband could handle it. I knew my kids could handle it. I wasn't sure how my mom was going to handle it.
Yeah.
And, you know, it's where I got my genes from, from my mom. She was obviously very concerned and really scared for me.
For sure.
But she also put up a very strong front. She did as much as she could for me emotionally.
Yeah. We have chatted a lot about this, and you've always been very...
And cried a lot.
And cried a lot. You've always been very positive. Like this wasn't going to beat you. Where did that strength come from?
My mom. She's the strongest woman I know, and she would never, ever let anything get her down. And she's tough. She still is tough. And I learned from her to forge ahead. I learned on my own to take a break every once in a while, and it's okay. I am too young to let this beat me.
What's next for you and how you approach this? You know, the first year is behind you. Do you let yourself take that deep breath yet? No.
No, because I think once you get a diagnosis, you're always on the lookout.
Yeah.
You know, I just am not going to let this get in my way. I'm not going to let it overcome me, consume me. Oh my gosh, I can't do this, I can't do that. You know, it might come back, and you know what? If it comes back, I'll deal with it.
Yeah.
I'll make sure I do everything I need to do to monitor it and keep an eye on it. But girl, I'm gonna live my life. I'm young.
Yeah.
And because I have a platform like this, I'm gonna tell any woman that will listen to me to get a mammogram.
Yeah.
Because it saved my life, and it will save yours. And I know you've got yours coming. And I know a lot of women already have said, I got my mammogram, because it's so simple.
Yeah.
Like, why not?
Well, thank you. Thank you for sharing your story.
It changes your life forever.
Terry just bravely shared her story with us, but that's just the beginning. October is Breast Cancer Awareness Month, and one of the biggest things you can do for yourself is to get that mammogram.
That's right. We teamed up with Solis Mammography to kick off a big initiative here at ABC 15 called Checkup AZ, where we will be reminding you all year long to get your mammogram. Because as I learned, early detection can save your life. But first, you have to start with your annual checkup. Well, now that I've shared my journey, I think you all know the importance of getting a mammogram, right? Well, I am very excited. I am with doctors Alyssa Floman and Dr. Karen Estrada at Women's Health Arizona, because it really does start with that all-important annual exam, right?
Absolutely.
So kind of walk us through, Dr. Floman, what happens at an exam?
I think that we're going to do a comprehensive exam, but it's not just your pap smear.
Okay.
We're also going to be doing breast cancer screening.
Okay. And it's really about helping us, make us aware of our bodies, right?
Absolutely.
Right?
Absolutely.
And women, and we've talked about getting a baseline mammogram, but at what point should women get their first mammogram? What age?
So 40 is what we standardly say, but it should be very individualized. So this is where it comes into asking your doctor and talking to them about your individual history.
Okay, and that's why the consultation is so very important, right?
absolutely.
Or just having a conversation.
Right.
So, Dr. Estrada, is breast cancer genetic?
I mean, in part. So it's multifactorial. There are definitely genes that increase people's risk for breast cancer, and then there are some family histories that don't have an identifiable gene. So when we approach someone for screening for breast cancer, we ask them a full history of their family, and some patients are candidates for genetic screening. So for example, I have a very strong family history of breast cancer. Multiple women in my family have had breast cancer, including one woman that had 2 primary breast cancers.
Oh my.
Different cell types. And so I completed the genetic testing as recommended by my breast cancer risk score, and I actually began mammography in my 30s.
Oh my goodness.
And my
Okay.
mammography includes a screening breast MRI. So when we talk about things like breast density, when you have extremely dense breasts and they add that additional ultrasound,
Yes.
for women with a strong family history, they also have indicated MRI screening for their breast cancer.
So you say, don't be scared, right? Because you're going
Yeah.
to ask a variety of questions, right? And
Absolutely.
some alarms might be going off in our head, but there's a reason why you're doing
Early
that.
detection is very key.
So I want to talk a little bit about dense breast tissue, because,
Okay.
I mean, us ladies have that conversations all the time. Oh, mine are dense, so are mine, you know.
Yes.
So does that play a factor at all in the probability of getting breast cancer?
It can make screening, especially with just a mammogram.
Okay.
It could make that sometimes more difficult. So you may, don't be surprised if they call you back to do additional screening with a breast ultrasound.
Ah, okay.
Sometimes we can feel that on an exam. When we're doing a clinical breast exam, I might say to a patient, Man, I don't want you to be surprised if you get called back for an ultrasound. It doesn't necessarily mean your mammogram's abnormal, but your breast tissue feels quite dense to me.
Okay.
And so I think part of it is that fear.
Yeah.
You want to get the mammogram and you don't want to have to get called back.
Right.
But sometimes we get called back for various reasons. And I think it's important for patients to not stop
Right.
because of fear.
Right. What would you tell women who think that, you know what, I'm not sure if this is a lump or this is just me, or what would you tell them?
I want you to come in so that we can examine you and see what's going on, and then maybe order some imaging to determine that.
Right. And then after having that consultation with them and getting to know them, you can then determine if you need to have them get a baseline.
Correct.
No
Additional
matter how
imaging.
old they are, right?
Yeah, and then sometimes we have benign or non-cancerous findings on our imaging that require referral to breast surgery. We have great peers in our community that can see women and help them through things like breast pain, lumps that are benign but are bothersome to them.
Right. Do you follow your patients through a journey should they be diagnosed?
Yes, we call it cancer survivorship. And part of that is how do we provide evidence-based symptom management, especially for women going through chemotherapy and radiation. And it's not just breast cancer, any sort of gynecologic cancer, especially those that involve modulating hormones, right? Because it makes people very symptomatic. And so we have evidence-based treatment plans for those symptoms after people are diagnosed. And we call it survivorship. What does your quality of life look like after you have a breast cancer diagnosis? It's super important to us.
Yeah. It's super important to get your mammogram. Period. End of story.
Absolutely.
Thank you so much,
Yes, of
ladies.
course.
Women's Health Arizona, they have 25 locations across the valley and Prescott. Book online at womenshealthaz.com. Well, I just can't say it enough. Ladies, get your mammogram. It's a very important message. So where do you go? I'm so excited today. I'm at Solis Mammography. I'm with Dr. Erin Bravo. She is a breast specialized radiologist here. Thank you so much for having us here.
Oh, thank you so much for coming out. We're so happy to have you here.
Well, because this message is so important, isn't it? I mean, you're preaching to the choir every day.
Absolutely. Seriously, mammography, getting that annual mammogram is so important.
So let's talk about a mammogram, because I think there might be some women out here who just don't know what it is, what to expect, what do you learn? What is it?
You're exactly right. We hear the word all the time, mammography, mammogram. So what is it exactly? So this is a mammography unit. This is the unit that captures the picture. It is an X-ray, so there is a tiny, tiny, tiny amount of radiation in order to obtain the picture. And what this does is it allows us to analyze the breast tissue. What is going on? Are there any abnormalities that are happening in the breast tissue at that time?
So we know that it's very important for women to get these regularly, right? So let's talk about, because technology is also advancing all the time. So we talk about a baseline, right? That's that first mammo, and that needs to be done at age 40, right?
Correct.
Okay.
Yes.
What do you learn from that baseline?
So the baseline mammogram is so important. A baseline mammogram is the first mammogram that a patient will get. Current guidelines are that women at average risk have a baseline mammogram at the age of 40. This is so important, like I said, because this allows us, are there any abnormalities in your breast tissue at that time? Okay. Then we're able to deal with any concerns that we might have at that time. However, if the baseline mammogram is normal, that's fantastic. But this mammogram will still serve a very, very big role going forward, because in the future mammograms that you receive, we will constantly be looking for any subtle changes that could be happening on the subsequent mammogram.
That baseline follows you through your life.
Absolutely.
I mean, that's the Bible, right, of your breast tissue.
You are exactly right. That is the Bible of your breast tissue.
A lot of people think, and I took everybody on my journey getting my mammogram, so it's not scary. It doesn't hurt. You say most women will keep their Botox appointment before they keep their mammo appointment, right?
Yeah, absolutely. Like we were joking about. I said, hey, I never want to miss my Botox appointment, but getting that annual mammogram, it's not as enjoyable. It's not as much fun, but it is a very quick appointment, minimal pain, minimal discomfort.
Yeah.
A very quick exam. You did it. you can rest assured that you're doing everything that you can for yourself to find a breast cancer as early as possible.
That's it. That's really the message. What makes you guys unique here at Solis Mammography?
So Solis Mammography, breast radiology is our area of expertise. And so we do have the latest and greatest technology, which allows us to really do the best that we can when reading a mammogram. We use AI technology, reading our 3D mammograms, and this helps us to find cancers that are even smaller and smaller than we would without this technology.
Wow.
So we're finding cancers very, very early and at a very small size.
Which is the whole point of getting your mammogram, so that you can, if there's a problem, and we hope there's not, that you can detect it very, very early.
Absolutely. The other thing, this is what we do. We see breast cancer patients, we see women that are coming in with concerns about developing, that they could have a breast cancer. So we want to do everything that we can to make them feel comfortable. And we are good at that here because we have so much experience in that. And we understand this is stressful for women.
Because that's what they do. Well, Dr. Bravo, thank you so much. Don't go anywhere because we're not done with Dr. Bravo yet. We are going to continue to talk to her because, believe it or not, more and more women are getting diagnosed with breast cancer at a very young age. We're going to talk about that next and what to watch out for on social media. Thank you, Dr. Bravo.
Thank you.
Solis Mammography has 4 locations: Phoenix, Paradise Valley, Chandler, and Glendale. Call 833-510-9396 or visit solismammo.com.
That mammogram is so important, and it is key for early detection.
That's right, it sure is. But there is another way you can stay on top of your breast health, and that's with the self-exam.
How to do one, we're going to have that for you when Sonora Living returns. It is time to get your checkup, AZ. We will be reminding you once a month to take the life-saving step of getting screened for breast cancer. For more resources and patient stories, as well as information on why it's so important to act now and to not put off that mammogram, go to abc15.com/checkup. Now, one of the most important things you can do to detect breast cancer early is that monthly self-breast exam. We've heard this. We know we need to do it. And today we have Becky Hauser, mammography and breast ultrasound technologist, joining us this morning. She's going to show us how to do this properly. Thanks for being here.
You're welcome.
Why is this so important to do?
It's just really important to get to know what's normal for your breasts,
Okay.
to detect any changes and let your doctor know if you find anything.
Yeah, you got to be familiar with them to know if something's
Exactly.
abnormal.
Exactly.
When should we be doing these?
If you're still having periods, you should wait until a few days after your period ends.
Okay.
That way your breasts are the least tender and less kind of hormonal changes.
Okay.
If you're postmenopausal, just pick a day. The first day of the month, whatever is
Yeah.
good for you that you'll remember to do it.
Put that reminder in your
Yeah,
calendar,
exactly,
right?
yeah.
Okay, how are we supposed to be doing this? Arm up, lying down?
Yeah, the best way to do the most thorough breast exam is to lay down, put a pillow or a towel underneath the breast that you're going to be examining.
Okay.
Put your arm up over your head. You're going to use these 3 fingers here to do it, and you're going to use not only light but medium and then firm pressure. You're going to start up in the axilla. Basically, the one thing you've got to make sure that you do is go from the clavicle, the collarbone, down to the bottom of the breast. Go to the side where the seam is of your shirt. That's all breast tissue too. And of course the cleavage is a fixed area. But you're going to want to start up in the armpit and just kind of start and just kind of go and feel.
Like almost little circles.
Like little circles, and you can go like straight to the nipple, and you can do it kind of like spokes of the wheel. You'd be going like this and just following and just feeling
Okay.
all that breast tissue as you go around. Or you could start at the nipple and work in a way like a spiral type thing.
you
you want
wanna
to
go
make
out,
yeah.
yeah.
You want to make sure you cover all that tissue because it's very important to make sure that you do that.
And you also say to be standing in front of the mirror,
Right.
naked, so you can look at your breasts and see if there's something.
Right. Once you're done with that, then go stand in front of a mirror. Just kind of look and see that there's no redness, there's no nipple changes, anything like that. Put your arms up over your head like this and kind of tilt around. Make sure nothing is pulling in.
Okay.
That type of thing. When you're doing your actual breast self-exam, though, you want to just detect any kind of changes.
Yes.
If there's a hard lump, if there's a thickening of the breast tissue, any kind of changes of the nipple, any kind of crustiness or
Yeah.
discharge or anything like that.
Go
And
see
that's-
your doctor.
And that's what you want
Yeah.
to go see your doctor or your gynecologist about. So.
Thank you so much. We
you're
appreciate that
welcome.
information today. We put more resources for you on our website, sonoranliving.com. And if you do find a lump and you need to get a mammogram, Solus Mammography is a proud sponsor of our Checkup AZ show today. They've got appointments available at any of their 4 locations. Call 833-510-9396 or visit solusmammo.com.
Coming up next, we're talking again with Solus Mammography about some alarming trends in young women and what to look for.
That's next on this special edition of Sonoran Living.
And as promised, I'm with Dr. Erin Bravo. She is a breast specialized radiologist at Solus Mammography, and we learned so much from you earlier, Dr. Bravo. But I want to talk about one thing that I find really alarming, and that is more and more women under the age of 40 are getting diagnosed with breast cancer.
Yeah, that is an alarming trend that we are seeing over the past few years. Rates of breast cancer that we diagnose are increasing across all ages, but unfortunately, the rates are increasing at a higher extent in younger women.
Wow.
Yeah.
That's scary.
An alarming trend,
Yeah.
definitely.
So here's where it gets confusing, right? We're being told don't get your mammo until you're 40. So what do women under 40, if they're worried, what should they do? What do we need to tell them?
We need to educate women. We need to empower women to make a decision for themselves. Yes, you are absolutely right. The current guidelines are for average risk women to get a mammogram at the age of 40. But now that we know breast cancers are increasing in younger women, what can we do? So I would encourage women to talk to their providers, see about getting that baseline mammogram, that first time mammogram between the ages of 35 and 39.
So you said, but it's based on, like, you got to know your numbers, you got to know your risk. So what do women who, maybe their mothers have breast cancer, grandmothers, I mean, is that what we should be worried about?
Yes, definitely know your family history. Family history of breast cancer certainly does make you at an increased risk for developing breast cancer. But not only family history of breast cancer, other types of cancers, like ovarian is a big one, prostate cancer.
What?
I know,
Really?
I know, absolutely.
So any cancer on any side of your parents?
Correct, not just on your mother's side. So you need to know your family history on both your mother and your father's side.
So if you have a history and you're concerned, you should probably go to your doctor and say, hey, I've got this, and they order up the baseline, right?
Correct. Yep.
Okay, and we talked about that baseline earlier, how important it is. So know your numbers, and you know, when you come in, and I'm talking about women at any age who get that very first mammogram, we talk about breast density, and we hear it all the time. That's another concern. What do you learn that in that baseline mammogram, and you share that information?
Right, you're absolutely right. That baseline mammogram, we're able to tell, are you considered to have dense breast tissue or not dense breast tissue? This is important because although mammography is still the most important imaging tool for patients with dense and non-dense tissue, finding cancers on dense breast mammograms can be a little bit more challenging because you're trying to find that abnormal white amongst a sea of white.
Right.
And so we often recommend these women to add in ultrasound every year. Ultrasound is a backup to mammography in women with dense breast tissue, just to make sure we are doing our job the best that we possibly can.
Okay, and that's a recommendation coming from you after I get a mammo.
Correct.
Okay.
Yep.
And you guys do that here as well.
Absolutely.
Okay, so
we
it's
do.
kind of a one-stop shop.
One-stop shop. Yep.
Okay, and then also I said earlier about social media and what's happening out there, and it's concerning to you. And what do you want women to be careful of when they look at anything on social media about mammography?
Yeah, it is concerning because there is a lot of misinformation out there about mammography, saying that it's harmful for patients and it can cause breast cancer. This is absolutely false. mammography is so important. Yeah, you are getting exposed to radiation, which we want to try to minimize, but the amount of radiation that one gets when getting a mammogram is teeny, teeny, teeny tiny and does not result in breast cancer.
And should not stop you from getting that all-important mammogram. It's your first line of defense. Pinky, promise me you're going to keep up the good work.
All right, I will. I will.
Thank you, Dr.
so
Bravo.
much.
Okay, here's more information. Solis Mammography has 4 locations: Phoenix, Paradise Valley, Chandler, and Glendale. Call 833-510-9396 or visit solismammo.com.
When it comes to breast cancer treatment, there are so many options available. It can be really overwhelming.
Absolutely. But coming up next, I talked to a naturopathic oncologist about his approach and how it could help you with options. Coming up next on Sonoran Living. So I've shared my story with you at the beginning of the show. So if you have had a cancer diagnosis, you know what I'm talking about. You know how scary it can be. I'm very excited because throughout my journey, I have talked to so many different doctors, and there's one name that kept coming up, and that is Dr. Dan Rubin.
Hi.
With naturopathic specialists, and I'm so honored.
Likewise. Thank you.
I'm going to try and get through this without crying, but
Same.
I really am.
Yeah.
I really am, because this journey just, takes us for a loop. Yeah. We know we follow conventional medicine. We don't know anything else, maybe. Yeah. But I want women to know that there are options and there are alternatives. First of all, you become part of our medical team.
We should be.
Right?
Yes.
So tell me, what makes your approach to helping me different?
I'm a naturopathic doctor. I'm not an MD. I'm not a DO. I am an ND. And so I am raised with a philosophy of how we look at the body. The same physiology that anybody looks at, but it's how you look at it and how you approach it, the treatments that we use, the diagnostics that we use, how we sort of narrate and dissect out your pathology report. Looking at, for instance, estrogen metabolites in your body. Nobody's ever looked at that for you.
Right.
It's important, especially for a woman who maybe have a family history of breast cancer. Like, these are looking at, if I may, looking at your stool, your microbiome. There are clues in the stool that can give you clues about how estrogen may be metabolized in your body. True clues.
So there are different types of breast cancer.
Yeah.
There's a lot of them. For me, I'm estrogen positive, which, and not just me, but a lot of women diagnosed end up going through a variety of treatments. I did not have to do chemo, thank goodness, radiation, but then comes the medication.
Yeah.
That we're going to take forever in some cases.
5 years or 10 years.
Yeah, and it's all very scary, Dr. Rubin. And I don't think I'm unlike a lot of other women out there who go, okay, I've already done enough to my body. I don't really necessarily want to medicate it if I don't have to.
Right.
Tell me, what is your thought on that?
Well, standard of care is to at least have those types of medications offered to you, whether it be the sort of postmenopausal one, which are the aromatase inhibitors, or sometimes the premenopausal one, which is like the estrogen receptor modifiers, the tamoxifens out there. There are quite a few women who just can't tolerate them. They try 3 or 4 of them, and their bodies just, they don't metabolize them well.
Right.
And it makes them feel bad. And some of that comes from the significant reduction in estrogen that those provide to a woman. So the largest segment of our population, of our patients, are women with estrogen receptor positive breast cancer. So we have been forced, in a good way, of course, to come up with protocols to help manage these people. We have a lot of referrals from the conventional oncologists. They're patients who can't tolerate, because they can't tolerate those medications. They don't know what to do with them. So we become friends with those doctors, and we're a safe place for those women to come, or a safe place for those women to come to have that discussion. And get tested and say, and sometimes I'm like, you know what, the way estrogen works in your body, you really do need to take this medication. You really do. Because sometimes it's like, well, you could take it or you couldn't based on the data.
Right. But that's and we all have a choice, but we want to make the most educated choice possible.
About
Sounds
your
like
own
you,
body.
Yeah, you take a bit of a deeper dive
Each
into
person
that.
is unique.
Yeah.
Just because they have estrogen receptors on the cancer doesn't mean that they're 100%. What if they're only 30%? Right? And then you get bad side effects from the drug.
Right.
So then we have to negotiate that physiologically.
Because we keep getting told we need hormones in our body.
It's how a healthy woman lives.
So, but then we can't take them.
Yeah.
So here we are.
Right. So it really does take a lot of laboratory investigation. Not everybody is fit for just plain old standard of care. It doesn't work like that.
Right.
We're not designed like that.
I appreciate
And so
that.
we take the N of 1 very seriously. We listen, we care, and we are open to these discussions because this is cancer, and honestly, there's just no rules.
I appreciate you so much. And I hope you do too. Here's more information. Dr. Dan Rubin, he is naturopathic specialist located in Scottsdale. Call 480-990-1111 or visit the website listenandcare.com.
Well, cancer and cancer treatment can affect so many areas of your body, and one that's really important to stay on top of is your skin. This is Mariah Snyder. She's the owner of My Skin Therapy, and she's here to talk about how she can help. Thanks for being here.
Thanks for having me.
Cancer or no cancer, you customize your treatments for every client's individual skin type because there's a lot of factors at play there.
Yes, there are. From your age, ethnicity, your lifestyle, a lot of things can affect what we want to do for your treatments.
Yeah, what we're walking in with, right?
Yes.
If we were a sun worshiper and our skin shows every bit of that, you're going to want to know that and you're able to address that.
Exactly.
And then if somebody has had cancer in cancer treatments, that can present a whole host of other issues that they're now dealing with. I mean, our skin is our biggest organ, so those treatments affect it.
Sure. Yeah, we can have compromised skin barrier, very sensitive skin, so we want to make sure we're focusing on hydrating, calming, soothing, and protecting that skin.
Yeah, the name of the game when you're talking about treating these cancer patients is calm, nothing too harsh or traumatic, because the skin, the body, it's already been through a lot.
Yes, exactly. So we want to focus on safety and comfort, and I want all of my clients to know and feel when they come to see me that that's a place that they can go, that's full of love and healing and where they can relax and recharge.
Yeah, and again, feel restored and feel good about their skin, right? I mean, that's what everybody sees. I want to talk about the jet plasma treatments that you offer as well. These are really unique in the sense that they're non-invasive, they're effective. Tell me how this works. What is included? What's happening with these treatments?
Sure. It uses cold atmospheric plasma, jet plasma, and ozone to create microchannels in the skin that allows you to create collagen and elastin. It's used for a lot of different things, skin tightening, hyperpigmentation, acne.
I mean, I'm looking at the list of issues that can treat, you touched on some of them, cellulite. I'm like, okay, I think a lot of people would be interested in that. And I like it because there's no downtime.
Yes, correct.
Or you could go out, to dinner or lunch and nobody would know you've really had anything done.
Exactly, yes.
Okay.
We do have some aftercare instructions, but as far as, there's no trauma to the skin, so you're good to go.
And the results are pretty impressive. You've had great success with this.
I have, yeah. I have one patient who is using it to help regrow his hair. We've had great success with that.
And it lasts a long time. If you're doing it for, the acne scars or whatever you say, it can last a couple years.
Yep, 1 to 2 years, up to 4 years, depending on your home care and maintenance and how you take care of your skin after the treatments.
That's always the key. We got to take care of it after we go see her, right? Yes. We can't just forget all the good things that you've done for us. Really good information, and again, helping a lot of patients who've gone through that cancer treatment, and they just need to calm things down, and you're able to offer that. Thanks for being here. We appreciate it.
Thank you.
And if you want to see what My Skin Therapy can do for you, give them a call now and get 10% off your first facial. They're located at 2680 East Germain Road, number 28 in Chandler. Call 480-823-1566 or visit myskintherapyaz.com.
I appreciate about learning of all the different options available during treatment. We hope you find it helpful too.
Yeah, absolutely. Up next, we're going to have the story of a young woman who has turned her diagnosis into a purpose to help others. That's still to come on Sonoran Living.
When you go through cancer, you know that life is short and you never know what's going to happen. Hi, I'm Ashley Plum and I'm a breast cancer survivor. 2017 was when I was diagnosed with stage 2B triple negative breast cancer. So one night I was getting ready for bed and my brow was irritating me, so I took it off and I was itching where it was irritating me and I went, that feels like a marble. That's not supposed to be there. You know, at 36, you're not necessarily, it's not quite on your radar. So it was, you know, like kind of a shock. I kind of fell in the more aggressive form of breast cancer. Triple negative is fast growing and tends to be more aggressive. So the treatment needs to be more aggressive. Oh goodness, chemo. When they told me that I was going to have chemo, that's when I had a breakdown. But I remember being in the shower. It was exactly 14 days after my first chemo treatment. And I'm in the shower and my hair starts coming out in my hands. It wasn't big clumps, but I just remember looking down at my hands and seeing my hair and knowing what was coming. It was a really bad day. I had a complete response to chemo, which means that when they did my double mastectomy, there were no traces of the cancer left. It's part of who I am. It's a blip on my radar, and now I'm stronger because of it. So I'm proud to be a survivor.
And now we are welcoming Ashley as she is joining us on the set this morning using her personal journey to now help others because she is the executive director of the nonprofit Check for a Lump.
And welcome to our set, and thank you so much for sharing your story, Ashley.
Thank you.
Really, really very riveting, and I know it's a very personal journey for you, so thank you for doing that. Let's talk about the most important reason we're all here today, and that is early detection. And I love the fact that Check for a Lump offers up free mammograms. Can you tell us how that works?
Yeah, so our free mammogram program is pretty simple. Patients can go online to our website, checkforlump.org, go into our free mammogram tab, fill out the application. We'll review it with our staff, and you'll get an email notification whether you've been approved or not. If you're not approved, we also send resources to where we recommend you go for assistance should you not qualify for a program.
Okay, so I want to continue on the resource path because should there be a cancer diagnosis once you get the mammogram and the testing, you guys have resources available for treatment options, follow-ups. There's so much information you kind of help folks figure out what's available.
Yeah, we offer, so we don't ever get the results of the mammogram. We rely on the patients to reach back out to us, and when they do, we refer them to either our magazine or our website. We have a ton of free resources available for medical, just other nonprofits that might be able to assist them, different kind of special retreats, things like that. So we also, we always want to give them options. So that they know that they're not alone, that there's a lot of stuff out there. There's a lot of people out there that are willing to help them.
Oh, that's wonderful. And the information can be overwhelming, so thank you for condensing it down. And you were doing the math for us earlier. You almost 300 free mammograms a year is what you guys offer.
Yeah, we're close to 300.
That's a lot.
We're hoping,
that's a lot,
right?
It is. We want to do more than that. Of course, we have big dreams with that. So we also So that's just our screening mammograms. We also provide follow-up diagnostic testing should the woman need that after her screening mammogram.
Yeah.
And we cover that all the way through either an all clear, which we're always hoping for,
Right.
or a diagnosis.
And nobody wants the diagnosis, but some of the other options that you, or services, resources you offer up, free
Yes.
wigs, education, support.
Yeah,
Tell
so
us
our
about
free
that.
wig program is free wigs for women that are going through breast cancer treatment that causes them to lose their hair. So usually chemotherapy. And we send them to one of the local wig shops that we partner with, and they get a free new wig. We pay the bill up to $300.
Wow.
Okay, wow.
Yeah.
Okay, so all of these services that you are providing, they're not cheap, they're certainly
Right.
not free. So you do a lot of fundraising
We
and you rely
do.
on the community to
Yes.
help. So how can we help? How can our viewers help?
So we couldn't do what we do without the help of our community and our funders and our supporters, because the programs can be expensive. Mammograms are expensive, wigs are expensive, everything is expensive.
Right.
And we want to be able to help as many people as possible. So the
Yes.
best way for people to get involved, we always have all of our events that we're doing on our website. You can make a monthly donation, you can make a larger one-time donation.
You can
You
volunteer.
can volunteer.
Yeah.
You can sponsor.
Yeah.
All
of
of there's a
options to
lot of options. I'd be happy to talk to anybody about all the different options that we have.
Ashley, thank you so much. Thank you for continuing to share your story and leading the Check for a Lump nonprofit. We appreciate you for that.
Thank you.
All right. And
Thank you for having me today.
Absolutely. And if you'd like more information, just check out our website, sonoranliving.com. Ashley is such a powerful presence, isn't she? And she wants to make a difference.
Yeah, she's pretty amazing. We appreciate her sharing her story. We want to remind you that Solus Mammography is a proud sponsor of our Checkup AZ show today, and they have appointments available at any of their 4 locations across the valley. Call 833-510-9396 or visit solusmammo.com for more information. We'll be right back.
I was only 55, so I felt like very young. I still feel young. I'm Helen Farner, and I had breast cancer. The bad thing with me is that I'd always gone to have my breast exam, and I did, and then I went for a period for about, I guess it was about 4 or 5 years that I didn't. And then that, I guess, was when it started developing. And it was stage 3. And I ended up having to do radiation and chemotherapy and finally a mastectomy. The hardest part, I think, was telling my kids. We have 2 children, grown adults, but it was like everything I was fine. But the hardest part was telling our kids I don't know why that was so difficult. These were grown adults, but it was just something of like, you're going to leave your kids? So that was hard. I've been cancer-free for 10 years. I wear this necklace. I had a girlfriend who made this for me, and it says, badass, oh, can you say that? Warrior Princess. And she made that because another friend had said, oh, Helen, you're just one badass warrior princess, you're going through this. And I was like, that's exactly how I felt. And I wear this every single day.
And that, my friends, is exactly why you need to schedule your mammogram on a regular basis.
Yeah, you have to prioritize yourself, right?
Yeah.
And we're so grateful for Helen sharing her story. She's been through a lot. She's doing great right
Yes.
now.
Yes, she is.
And we're grateful to you for sharing
you.
your story as well. That took a lot of bravery.
Thank you.
All
I
right.
hope it makes a difference.
It does. And as for prioritizing yourself, if you need to get your mammogram, ladies, Solus Mammography, they are a proud sponsor of our Checkup AZ show today. And they have appointments available at all 4 of their Valley locations, 833-510-9396 or solusmammo.com to get yours scheduled.
Schedule it now. I'm going to be watching you. We're going to do this campaign all year long, right? So we're going to keep reminding you, ladies.
Prioritize yourself. prioritize your health, too.
That's right.
Yeah.
That's right. All right. Well, thanks for watching. Make it a great day. Bye, everybody.